very exciting things that we're really excited about, and our HR team is here to help you, support you, and connect you with some of the changes that are going through, along with our Aetna rep, Kim, who's been with us the last few days, and he's probably looking forward to going back to the office for a while, but we're excited to have her. So a couple things, moving away from Cigna. Cigna's been very good to us, as you know. Had a very good plan. I was looking back to some of the messages as I'm going through the documents here with Aetna. Probably been 9 or 10 years we've been with Cigna. So they've been very good. However, Aetna came along and submitted a proposal to us, and we were able to save some administrative service fees. They were very aggressive in that respect, so that's why we're transitioning. Not a reflection on the service or the benefits that Cigna provided. It's just an economic decision that Aetna came along. So we're proud to have Aetna along, and we're going to go over some of the changes. A couple other things. Number 2, we're offering an option. I was very excited to hear from our active members, and you guys are going to have to evaluate to what extent that it serves your purpose, particularly if you have dependent coverage, because dependent coverage is going to be a little less. You're going to have more out of pocket, but then as we evaluate the benefits piece, there's going to be a decrease in the benefits, and that would offset some of the premiums that are contributions that we save on the dependent side. So those of you who are retirees, and you guys fall within those tiers, as you know, you've got different. I think we've got 5 tiers of retiree subsidies right now. Those haven't changed. So, for example, you're going to see the premium contribution for single coverage. If you fall in that first tier, your coverage is covered at 100%. It's just when you get into that second tier, whether it's 50% or $8 per member per year of service, and that's going to be subsidized, going to be affected by that contribution. So that's the second thing, and we're going to go over the 2 options, 2 plans. But we're excited to offer it. It's the first time that I've been here to that city's offering an option that our people will be able to choose the different plans. And then lastly, for all of you who use the health center, the employee health center is still available. We've got a really important benefit there. Hope you all are taking advantage of that. So,
on both plans, Joe?
I'm sorry?
On both plans? The enhanced
Yes,
and the value?
Yes, sir. Okay. I'm not going to take up any more time because we have another meeting coming up at 11 here. So I'm going to turn it over to Laura and Kim. Have a lot of information to help you go through the coverages and the enrollments, because this is a new plan. So you got to have those enrollments complete. But you want to also have an understanding of the 2 benefits, or the 2 plans, the enhanced plan and the value plan. I'm going to turn it over to Laura to start it. Okay, thank you. Thank you again for being here. Appreciate it.
Good morning. Thank you for coming in. It's like your own reunion for some of you, and it's kind of nice to see. This is probably the largest class count I've seen of retirees in a enrollment meeting we have. Even the November meeting for Medicare, typically we don't have this difference. So thank you for coming in. For some housekeeping, you should have received a postcard like this in the mail. If you did not receive that postcard, let us know, because there's one of 3 things. Either your address with Cigna is not correct, your address with HR is not correct, or your mailman just didn't deliver it. But we can solve the first 2. So, we'd like to do that even though we're asking you to fill out the new form, just so if there's any more communication between now and open enrollment ending, or, you're still with Cigna, if you have that coverage until September 30th. So we wanna make sure we're clean on the end when we end it. If you noticed, if you did receive the card, there's a phone number on the bottom of this. If you tried calling that number, you may have received an Aetna representative that was unsure of the plan. It was a transitional number while we finalized some things. Now, you should have a card in your packet stapled to some of the paperwork. And this is our dedicated concierge or customer service number to call. This number, they will have provider information for you, so if you're continuing with a doctor, you want to stay with a specialist, and you want to know if they're with Aetna, they accept Aetna, you can call this number on the card, and they can provide you with that information. Kim will go over how you transition if you're not. If you'll turn it over, if you've got a pen, we can give you our group plan number, because when you call and you say, if they say, who are you with, and you say City of Titusville, we all know, living here, probably you've come across people do not know how to pronounce Titusville. Some do not know how to spell it. So it's much easier to give them a numeric number, and there's no confusion. So it's 143060.
That's the Aetna group plan number?
That's the group plan number. 143060. So if you give them that number, you have a dedicated team. Aetna has teams that handle just certain accounts. We have a dedicated group that will be able to assist you with the plan coverage, provider information, and they do quite a few other added bonuses that they can provide for you. And Kim will give you some of that information. So, if you call today, they'll be able to provide you with provider information. If you call tomorrow, they should have the plan documents uploaded and be able to help you with the plan questions. So, we ask that you have a little patience with us since it's a new group. And if they cannot provide you with plan information today, they will be able to tomorrow. Also, you should have in your packet, just so when she starts covering things, you should have in your packet an open enrollment form. That enrollment form should be able to, here it says employee on it, but it's a generic form like we've used every year. Sections A and D are for the city to complete. Sections C through F is what we're asking you to complete. So if you'll pull that form out and look at it, we'll go over it quickly. Section C, you'll put your name and fill out all this information. And we're trying to capture data so we can make it easier for everyone to get the information when there's a change or something needs to be dispersed. So it says email address and phone number. We ask that you provide it, but it's not mandatory. If you don't want to provide it, leave it blank. But we're asking you to help us help you if we have that information. If you're just picking up single coverage, you'll go down, and about halfway down in section C, we ask that you repeat your information, and you'll have to write it again. That keys us in to know that you're picking up single coverage only. Please don't leave that space blank. If you have spouse or dependents, that's the next part of the information. Section D is the two different plans, the enhanced and the value plan. So we'll ask that you check one of those boxes. Section E is if you have secondary coverage, we ask for that information there. And section F is your signature. We have to have these forms back by August 30th. It's a mandatory enrollment, and what that means is we're changing from a different plan administrator. So we have to have a form from each and every one of you. If you're waiving coverage, meaning you're declining the coverage if you declined it in the past, even though section B is for the city, you're you're gonna mail it back in and not bring it to us, if you will mark in the section B, other, and write decline. And then sign it, date it, make sure you have your name on it. That's all you'll have to fill out if you're declining coverage. Are there any questions about that?
Just on F, employee signature, you need a spouse signature also?
We don't need a spouse signature on
Okay.
there, as long as you're the primary coverage. If they're adding, if they have the Medicare over here, you need the signature.
Me?
Yeah.
Oh. I'm in the Medicare coverage. My wife is not yet.
Right,
How does this form get filled out for her since I'm not in?
yes, you're the employer covering her. She's not, so in other words, you would fill your information out here, for her information, and it keys us in right here when you don't put your name on the employee. So if you do not have active under 65 coverage, you would not put your name in that section where it says employee.
Okay.
That's why we're asking, if you put your name there, we're gonna, so we clarify with you, because we'll be able to look at the date of birth also.
Well, you understand I asked the question because of the difficulty we had in getting her coverage or getting my coverage separated from her coverage
Right,
from, okay.
yep.
In section E, under insurance, is it included, covering spouses as a secondary?
Yes.
Somebody was talking, so I couldn't hear you. Choose a plan, do we have to choose one of those on D?
Unless you're waiving the coverage, those are the only two plans we offer to the under 65 group. And she'll explain the difference in the two. Yeah?
Name of person covered, that would be my wife.
Yes.
Say what company?
No, they don't,
Other carrier?
we don't need that. Okay, so we'll move on to what else is in the packet. You should have two documents that look very similar, but they're different. Up in the right-hand corner, one says enhanced plan, and one says value plan. They're very small in the writing, but they are two different documents. Make sure you have those. Okay, we'll go over those with you. We have a PowerPoint demonstration in your packet. And that's what her presentation will be today. You should have a preventative medicine packet. She'll review that with you. And then you should have the rate sheet. And Joe touched on that. Make sure you have, everyone in the packet has a revised rate sheet. If you were given this document before today, or if I didn't email it to you last night, the very bottom of the rate sheet said $8 per month, and it should say $8 per year. So, we're gonna let him go through the plan, because I'm sure you're wanting to hear all about that.
Good morning, everybody.
Morning.
My name is Kim Howell. I'm actually going to be your Aetna account executive. For those that may be Medicare eligible, if I look familiar, I have been the account executive for the Medicare Advantage plan. That's one of the options for the retirees here. So it's my pleasure to also now help you on the plans that are offered to the pre-65 and the active. Cigna is a wonderful company, so I have big shoes to fill. And Aetna's gonna do everything we can to make sure that the plan works well for you. It's been a pleasure to be here this week, getting to kind of know some of the folks out this way. So why don't we go through the presentation? You'll notice when you flip to that first page in this PowerPoint presentation, you see Aetna Choice Point of Service 2. So when you see that, the reason that's printed there is that is the name of the type of Aetna plan that you have. Where that becomes important is if you go online, which you're welcome to do, to Aetna.com, you can actually do a search for providers and go in as a guest, because of course right now you don't have your Aetna ID number. When you go in as a guest, it's gonna ask you what type of Aetna plan do you have? Well, this is the name of the plan, because you can imagine there are a lot of different Aetna plans nationwide, right? So this tells you which plan to pick on that drop down. However, we're gonna talk about the fact that our concierge customer service team can also help you with that. Point of service also means, just like you're used to today, that you have both in-network and out-of-network benefits, just like you do with Cigna. Also, just like you do today, no referrals are required when you go to an in-network specialist. So that's what that point of service really is mentioning. Why don't we go to this page that kind of does the side-by-side comparison? Because this year you have a choice to make. When you're looking at it, you see the word enhanced. That really mirrors the current Cigna plan that you have. We modeled it exactly after that. But you also have the ability to potentially look at this value plan and see if that plan is going to be better for you. When you're comparing the two, the enhanced plan versus the value plan may save you a little bit out of your premium monthly, but you're gonna notice as we go through it, it costs more when you use it. So let's look at both of those as I'm going through it. I'm gonna work to kind of contrast what's the same on both and what are the differences. Yes, ma'am.
If I choose to stay or go with, let's say, the enhanced plan, and I wanna move my dependent or my spouse to the value plan because of the premium, or conversely, can we do that? Can you be covered? Can
Good
you stay
question.
with it, and can you move the spouse, dependent, or whoever to the other plan?
Very good question. So the way that it is set up, if you were covering them as a dependent under you, everybody, you and the dependents are gonna be on the same plan.
Yeah.
You're gonna have to be on the same plan. Good question, though. So where both plans are the same or similar is, of course, your preventive care is covered at 100%, just like it is today on the in-network side for both the enhanced and the value plan. The other thing you're gonna notice when you look at it, you don't see a different network name at the top. So it's the same network of doctors, hospitals, and other facilities. So no difference there in either plan. Both are the Aetna Choice Point of Service 2 plan. The differences are on some of your benefits. One other thing I want to point out that is the same is if you look at your prescription drug coverage, that's going to look really familiar. If you notice, it's a $5 copay for generic. That's what you're paying today. If it's on the preferred list and in generic. The name brand is a $35 copay if it's on the preferred list. And then if you happen to take a medication that's not on the preferred list, it's a $60 copay. So similar to what you have today, and you'll notice that is the same under either plan. So your prescription coverage is going to be the same under whichever plan that you choose. I want to point out, you'll notice where it says MOD, that's mail order delivery, or CVS. Remember, under Cigna, and it will be the same under Aetna, you can get a 90-day supply at CVS. So for anybody taking advantage of that currently, you're just gonna wanna show your Aetna card after October 1st and continue to get that 90-day supply right there at CVS. If by chance you decide you wanna go to Walgreens and get a 30-day supply, you can do that. You just need to give us a call at that concierge number and say, listen, I don't wanna do that 90-day, I just wanna go every month to Walgreens and pick it up. And then they can make sure that the system accepts that 30-day supply coming through monthly. But I wanna point out that is the same as what you have today. So now let's talk about some of the differences. If you look at the top, under deductible, you'll notice $1,000 per individual, $3,000 for family, $2,500 on the value plan, and $7,500 for family. So right there you see a difference. Remember I mentioned it can cost you more when you use it, but potentially less in your premium payments. So while we're talking about that, individual and family. So anytime somebody, one individual, hits that $1,000, your deductible is met. Same thing under the value. If you choose the value plan and you hit that $2,500 as an individual, then your deductible is met. The reason we also have the family there is if you were covering 3 or more people, we're also making sure that if you had a family of 4 on there, that we're not gonna have every single, all 4 people meet that deductible, and then that would be $4,000, right? So we're gonna stop at the $3,000. So it's the individual that you'll probably wanna pay the most attention to. Also, when it comes to your out-of-pocket, I want you to look down at that. $4,000, just like it is currently for individual, $8,000 maximum for family. Notice on the value plan, $5,000 individual, $10,000 family. So again, you can see a difference there on the value plan. When you think about your out-of-pocket, what that is every time that you pay a copayment to the pharmacy, to your doctor, anytime anything goes towards your deductible, we're adding that up, just like Cigna does today. If all those charges added up to $4,000, what that means is for the rest of the calendar year, if you go in network, then everything is gonna be covered at 100% because you've already paid enough. You paid up to that maximum. So that's something I hope never happens to you. But if you were in the hospital for a few days, what you know is even if that bill were $600,000, your maximum, right, for a calendar year is that $4,000 if you're on the enhanced, or $5,000 if you choose the value plan. Your deductible and your out-of-pocket run from January to December, right? Well, you're coming on to Aetna in October. So you may be wondering, well, what about the deductible and out-of-pocket that I've already met for 2019? We are working with Cigna to get a file from them so that we can put in the claim system what you have already met for 2019. So that you will get credit for everything that you've already met under Cigna. That's in process right now. What we're gonna also do, sometime probably in November, is we're gonna ask for a second file because we know there's gonna be a few claims coming in, right? End of September, maybe even into October. And we wanna make sure that we give you that credit as well if you had anything incurred after that comes through and gets processed. The other thing you can do is, let's say that you have a procedure scheduled for October the 10th. Excuse me. And you call the concierge team and they say, well, we don't have your deductible credit yet. If you have a statement from Cigna, an explanation of benefits, that shows how much you met of your deductible, the representative on that line can take that from you and we'll use that to go ahead and update our system in the event that the timing of getting that file is not gonna work based on some of the things that you have scheduled. So we have that as an option too. So we're gonna automate it so you don't have to tell us. But if it's a situation where you wanna go ahead and get it in so that we show that credit early October and we're not showing it yet, know that you have that option. Any questions on the deductible, out of pocket? So again, you can see a little bit of difference there. Yes, sir?
Just go back to the medication for a second.
Yeah.
So I'm clear, where I go get my scripts, it's zero cost right now. It's not CVS. Does that continue?
That will continue. If it's a situation where maybe the store has that special,
Okay.
that could be. And I'm actually gonna talk about that when we talk about some ways to kind of save money. The other thing, and I'm glad you mentioned that with your prescriptions, is remember you have this list of medications that are at zero copay to. So you'll definitely take a look at that. So that should not, that more than likely will not change. Good question. Okay, let's talk about your office visits to your family doctor and the specialist. As you know, that's a $20 copay currently, same under the enhanced for family practice. You'll notice it's a $25 copay under the value plan. So you can see there's a $5 difference there. For specialists, $40 copay under the enhanced, that's what it is today under Cigna. $50 under the value plan. So again, you can kind of see the differences between the two plans. Urgent care, I do believe that this copay was reduced. I think it's higher currently, but the decision was made to lower that, and that will be $30 for urgent care under both plans. You'll notice that's the same. Walk-in clinics is gonna be the same as your family practice, and those are things such as your minute clinics that are inside CVS, or your take care clinics that are inside Walgreens. We don't have a lot of those here at this point. However, there may be some other walk-in clinics around, and if that happens to be where you go, then you know you're gonna pay the same as if you went to a primary care physician. So let's talk about inpatient hospital stay. If you use Parish today, as you know, same under Aetna, $450 copay, then 20% after deductible. If you look at the value plan, you're gonna see $450 copay, 20% after deductible. So it looks like that benefit's the same. Remember, the after deductible part, your deductible's higher under the value plan. So the benefit is the same, but because you have a higher deductible and a higher out-of-pocket, you are gonna pay more for an inpatient stay under the value plan. If you go to, for example, Advent Health, a non-parish facility today, same under Aetna, $750 copay under the enhanced, and then 20% after deductible. Notice under the value plan, it's $1,000 copay, then 20% after deductible. Yes, ma'am?
Is there a list of, hospitals that are out of network or in network that we're gonna know?
They actually, that is online. What I can tell you in the local area is Advent Health, Holmes Regional, Parish, just to name a few. Getting into the Orlando area, of course, Advent, Orlando Regional, Orlando Health, I think is what they're called now, some of those. So when you're looking at your inpatient benefit, I just want to make sure everybody sees the difference between the two plans. Both are very good plans, but I just want to make sure you recognize the difference between the two. When it comes to outpatient surgery, if you have that done in a hospital setting, $375 copay, then 20% after deductible. Also under the value plan, $375 copay, then 20% after deductible. But remember what I said about the inpatient. Because it's after deductible, the deductible's higher, you have a higher out-of-pocket, so your 20% can be higher. So just remember, under the value plan, it will cost you a little bit more when you have a surgical procedure done in a hospital setting. Yes, sir.
Let's go
Yes,
back to
Yes,
inpatient
ma'am.
hospital. I realize you just had Paris and wasn't quite sure what she was saying, but obviously Paris is not the only hospital that's in network.
Not the only
So
hospital.
what about Aetna and Woodstock, those are out of network?
Woodstock may be out of network, I'll have to check on that, or we can check with the concierge team. And what was the other one again?
That's not Holmes Regional.
Holmes Regional, okay, that was it.
That
That's all,
was
that's
it?
all health first. It's not,
It's not in,
Holmes is not in, right? You said-
Holmes is.
Holmes is in?
It is
Okay,
in.
great.
it's a home care, but you're not sure about Woodstock.
I am not sure about Woodstock, I'd have to check that, I'm not sure if I saw that listed.
That's fantastic.
Yeah,
It's Rockville.
so we can double check that, or if you happen to be calling the concierge team, they can double check that for you, but I can check afterwards too, I'll just try to do a quick search on my phone.
So other hospitals besides Parish are in?
Yes,
Okay, I was
Parish
just-
is not the only facility, but as it is today, if you go to Parish, it just happens to be that you got lower copay. So we're gonna continue that same thing.
'Cause they
when
can't
it
do
comes to
everything in
inpatient. No, they can't, exactly. So if you don't use that, if you take the enhanced plan, or like it is today under your Cigna plan, let's say you're inpatient at Advent Health, $750. So it's just a little bit of a higher copay. There is a little bit of a lower copay on the inpatient if you happen to use Parish.
Right, but.
Yeah, but you have access.
Orlando and every is here, but the next closest thing is gonna be Holmes, or else you're going, I don't think Woosnall's gonna be in it.
Right, so remember, we're just highlighting on here that it just happens to be a lower copay with some arrangements that have been in place with Parish. So you don't have to use Parish, but if you do, if it's appropriate, close to you, it's gonna be that $450 copay. Otherwise, for other in-network, absolutely, you have full access to the Aetna network, it's gonna be the $750 copay, just like it is today. If you don't use Parish today, same thing is gonna happen under Cigna, is gonna happen under Aetna, just a little bit of a higher copay. Okay, yes, sir.
I just found out recently, and only because I looked carefully at the benefits, but I had some elective surgery down at Parish.
Mm-hmm,
There are 0 anesthesiologists in network at Parish. Why is that? And I don't know how long that has been, but if people didn't look at their bill carefully, you paid way more than you should have. Now, Cigna corrected that. It's only charging in network
Right.
fee, but they wouldn't have if I hadn't called to ask them. So why are there no anesthesiologists in network? And is that something that is the same for Aetna? And how would you deal with that?
yeah, I can address that.
They don't have a contract, some do
Yeah.
and some don't with Parish. So when you go in for the same type of thing, say like kidney stones.
Yeah, I understand, but you
may
have no
an in-network,
choice. You
so
can't
it-
choose an anesthesiologist. The
Right,
doctor's
and
gonna.
so all that happens under Aetna is very similar to Cigna. If you think about it, when we go to any hospital, you got the group of anesthesiologists that operate out of that hospital, and to your point, you really don't have a choice. So Aetna, Cigna, United, all the carriers do attempt to contract with those anesthesiology groups that are based at the hospitals. Quite honestly, they realize, right, that regardless if there's a contract, guess what? They're gonna be the anesthesiology group that's utilized.
Right.
Sometimes that makes it difficult for insurance carriers to be able to go in and negotiate, but that's always attempted. So I'd have to look and see if perhaps we do have a contract with the anesthesiology group. But to what Laura was saying earlier, keep this in mind. We know when you have an inpatient stay, emergency room visit, or even an outpatient surgery, we as patients don't have any control over the anesthesiologist, the pathologist that actually are participating in that. So the claim will be paid in network. What happens though, because we don't have a contract, we're gonna pay it based on a reasonable rate. There can be times where after we pay it at a reasonable rate, that anesthesiology group comes back and says, no, we billed 1,000. Aetna, you said that it was reasonable to be 800. We want our other $200. And so if you get a bill, that's when you need to give us a call so that we can go ahead and go back and we will pay the remaining. But what we're trying to do to protect City of Titusville and other customers is, if they take that reasonable rate, we don't want to just initially pay that full bill charge, because many times they will take that reduced amount and say, okay, we'll take the 800 from Aetna, we'll write off the other 200. That's reasonable, because it's not based on our contracted rate, it's based on what's reasonable in the area. So please, make sure you do kind of what you did in that situation, it sounds like. If that does happen, just get in touch with us so we can work that out. If there's more money to pay, then absolutely, we need to go back and do that. Because to your point, we gotta hold the member harmless. We have no choice. And it needs to be paid in network. Sometimes, if it did get paid out of network, if that anesthesia bill came in before the other bills, the system may say, we don't see the in-network hospital bill here. If that were to happen, then we can go back and reprocess it too. The key is, use that Aetna concierge team, but I also want you to know, myself and Bernice Baldwin, the account manager, are here. And Laura and the HR team know how to get in touch with us. So if that happens and you need assistance, get in touch with HR so they can track us down, and then we can work on making sure that we get that resolved for you. So when it comes to outpatient surgery, let me mention this too. Freestanding facilities, so if it's a surgical center, you're gonna pay a copay of $250. So if you have a procedure that's been scheduled and the doctor feels it's appropriate to do it at a surgery center, it's gonna cost you less money. And that's actually the same under both plans. Emergency room, $300 copay under the enhanced. Notice under the value, it's a $300 copay, but after deductible. So your emergency room is gonna cost you just a little bit more under the value plan. So I wanna make sure everybody picks up on that. Let me just throw this out there, since we were talking about anesthesiologists. There are times when emergency physicians that operate out of a hospital may not be part of the network, for the same reasons we just talked about. So that same rule applies. We're gonna still pay that emergency physician in network. We're gonna adjust it to the reasonable rate. But if you happen, after we've done that, to get a bill in the mail for additional charges, make sure you reach out to Aetna, because we may need to release additional money to that provider. Go ahead and get that taken care of. And when it comes to in-network and emergency care, it's the same way under Cigna today, I'm confident. But just remember, in an emergency situation, you don't need to worry about, is that facility in-network or not, right? You need to get the care that you need. If it's not in-network, it was an emergency, and that's gonna be paid the same as if you went to a network facility. So your focus at that point is getting the care that you need. That's gonna be billed. We're gonna process it in network, because that's not something you can control a lot of times in an emergency situation. So keep that in the back of your mind so that you're not overly concerned, depending on where you happen to be at the time that happens. And then just make sure you continue to stay in touch with Aetna should you receive any kind of balance billing. Any questions on your benefits between the two plans? Really, when you're looking at it, what you have to think about is, what's the cost difference between the two? Would you rather pay more out of your premium, pay more in premium monthly, and less when you use it? Or is it better for you to pay less monthly and then potentially more if and when you use it? So just kind of weigh those things. So you're gonna wanna think about, do you have any upcoming procedures, or anybody you're covering have upcoming procedures? How many times do you visit a doctor? Because remember, there's a difference in co-pays. So those are things to kind of think through when you're making your decision. The goal was really to give choices. Put a plan out there that still had very good benefits, but perhaps would cost a little bit less on a monthly basis.
Question that maybe the city may need to address, when I look at my premium rates based on the two plans, the extended and the, enhanced, and the value plan, I was a little confused because you listed tiers as retiree, spouse, dependent. When I think of tiers, I'm thinking of tier 1, tier 2, and tier 3 in my percentages that the city pays. Subsidy. So are the subsidies for tier 1, 2, 3, and that fourth still going to apply 100%, 75, 50, et cetera, to the cost difference between either the lower rate on the value? Yes?
So on your sheet, I'm not sure what sheet you have, but it already takes into account, on the dependent side, already takes into account the subsidy.
Okay, but speaking to the retiree only, which has the
Right,
asterisk on it.
retiree only if you have.
Your subsidy
you're-
is, city subsidy is still gonna apply to the
Yeah, so if you're
premium rate.
right, if you're in tier 1, for example, there may be a cost on the employee, I don't know if you have that. There's a cost to the employee. So if you're in tier 1, there's no cost to you.
Correct.
Because your subsidy is 100%.
Right, and when I get to tier 2 and 3, where there is a cost.
Right,
That-
and you're going to, then you will share in that premium.
Premium increase or
Right.
decrease based on. All right.
Good questions, thank you for asking those. Any other questions on your benefits that we covered? Just want to cover a couple of more things. We talked about preventive care and preventive medications. Let's talk a little bit about the Aetna customer service team. You'll see a slide that says customized service for employee health care. The Aetna customer service team, we call Aetna Concierge, is available from 8 a.m. to 6 p.m. daily, Monday through Friday. And as Laura mentioned, they're already kind of getting to know you. It is a designated team for City of Titusville, so we're in the midst of training them. They can, of course, do some of the same things that you use the Cigna team for, which is, of course, I got a bill in the mail, is this right? What are my benefits if I happen to go and have a procedure done? They can do all of that. The concierge team really takes it a step further in that, of course, they can help you find a provider, so we encourage you to use them for that. If you're curious now whether your doctor that you're using is in network or not, you can look it up online, or you can absolutely give them a call and they will look that up for you. You're gonna find most of the time that your doctors are in network. They also can help you make an appointment with a doctor. So the example I've used is, let's say you visit your family doctor, you're having problems with your knee. That family doctor says, you know what, I think you need to get that checked out by an orthopedic physician. You can call that concierge team and say, okay, family doctor just said I need to go to an orthopedic specialist. Tell me who's close to me, tell me who's in the area. And they can kind of narrow that down for you, and then they may say, can we help you make an appointment? So if you want to use them for that, absolutely do that. Also, they're going to help you with cost estimations. So if you wanted to know, you met that doctor and he says, yes, let's go ahead and do some knee surgery, and you're wondering how much is that going to cost you, the concierge team can help you determine that, because they see not only what you met towards your deductible, they know the Aetna contracted rate, so they can kind of help you determine what is that going to be. So you can certainly use them for that as well. If you happen to call them and we need to get you over to, let's say, Aetna Specialty Pharmacy, they'll transfer you. They're not just gonna give you a number and say, call this number. So really, they're there to do whatever they can to help you. Let's talk about some of the other member tools. Yes, sir.
I should have asked this earlier.
That's okay.
You gave us the group number for the insurance. When will I assume we're getting new insurance cards.
You sure are.
By when?
Our goal is to get them to you before October 1st. So we're currently working, Laura and her team are fast working on trying to get the information in a format where we're going to be able to take it and load it in the system. So that's going on now. You will receive an Aetna ID card. It's going to have a W number on it. That's your member number. And once you get that, you'll be able to, when you call customer service, they'll see you and your information, and even be able to help you more than they needed on today. Also, you're gonna notice, just like with Cigna, we have a lot of member tools. We have the website, Aetna.com, for those that like to go online and look at your information. You can register for your own Aetna website, so you can look at your claims, you can send emails to customer service, you can look and see what discounts are available under Aetna. There's a lot you can do. The other thing we have, if you like to use your smartphone, we do have an app. It's the Aetna Health app. That makes it easier because we always have our phone with us. So feel free, once you get your Aetna ID card, to go to the App Store and just download the Aetna Health app. You can look at your claims. You can find providers. A lot of stuff you can do right there. You can even do cost estimations from your phone. So take advantage of that. If you're one of those that likes apps, likes to use them, why not give it a try? Let's talk about transition of care. So for transition of care, what I want you to know is if your doctor that you're seeing is in network, the only thing that you would need to do is to give a copy of your Aetna card after October 1st so they know to file that claim with Aetna. If you find that your doctor that you're seeing is not part of the Aetna network, when you call that concierge team, there is a form. It's called a transition of care form. There's part of the form that you would fill out, and there's part of the form that the doctor would fill out, and it's this slide right here, in case you're wondering where I am. The doctor will put medical information on there. You put some of your information. Then that's reviewed by the Aetna medical team. And depending on the circumstances, they'll make a decision on whether maybe due to medical reasons, you may need to continue with that provider for a period of time and have Aetna pay that on an in-network basis. So depending on the circumstances, that's what that transition of care form is there for. So HR has a copy of that, as well as our concierge team. So when you find that, fill it out. The other thing I would ask you to do for me is if you find that your doctor is not in the network, absolutely let HR know, because I want to know that. Because what I'm going to do is work with our network team and say, these are the doctors in Titusville that are being used that are not part of the Aetna network. Most of the doctors are part of the network. I would like for our network team to at least give it a try and see, is there a chance of getting that provider or provider group into the Aetna network in the future? Honestly, there are times where we can, and there are times where we cannot come to an agreement. But I'd like to at least give it a try for you. So just make sure that that information gets to HR so that we can kind of track that, work with our network team, because if I can get that doctor in the network for you, I would love it. So just keep that in mind. Any questions on that? The other thing I want to mention after you see the transition of care, I mentioned some money saving tips. Had a gentleman mention just a minute ago about the $0 copays. Remember, you've got that preventive list of medications. The other thing I'll mention is, and you may have noticed, when we go into your Walgreens, Walmart, Publix, Sam's, Winn-Dixie, anywhere that has a pharmacy, have you noticed when you walk by the pharmacy, they always have a sign up that says, here are the following medications, $0 copay for antibiotics at Publix comes to mind. Or every pharmacy kind of has their own list, and either it's a $0 copay, or you may even see a sign that says a 90-day supply for $12. If you're shopping there anyway, it doesn't hurt to go by the pharmacy, kind of scan that list. If you're paying $5 for something that a particular store has for $0, might be something to take advantage of, right? So just kind of look at that when you're shopping anyway and see if there's any savings for you there. The other thing that I like to always remind people of is, remember, our doctors have samples. Where that becomes important is if you're in a situation where you've been prescribed a medication for the first time. So they want to put you on a blood pressure medication. You haven't been on one before. When you get that filled at the pharmacy, you start taking it, the first thing the doctor says is, okay, come back in 2 weeks, right? Let's check and see if that medication's working. A lot of times when we go back, they may have to make adjustments, right? So now you're going back to the pharmacy, getting another prescription filled, paying another copay. If they have samples, that saves you a trip to the pharmacy and a copay. It allows you to take that medication, go back and see, is that going to be the medication and the dosage that you stay on for 6 months or more? Just something to keep in the back of your mind. Many doctors are really good about, when they first prescribe a medication, giving you a sample if they have it. If they don't mention it, it's always worth mentioning it to them. Hey, do you have a sample of that? And that way you can try it, take it, and then when you know that you and the doctor know, okay, we got it where we want it, here's your medication, I'm gonna write a 6-month prescription, then you can take that to the pharmacy, CVS, get a 90-day supply. So just a couple of things that I hope might be able to put in the back of your mind, might save you a little money along the way. All
I
right.
have another question. on
Yes,
the
ma'am.
plans. So these two plans, enhanced and valued, are good for 2019-2020. So let's say I sign up and I decide to move to the value plan because I got lower dependent premiums, et cetera, and this year goes by and whatever, it's too much money for me, I don't like it, whatever. Will I have, are both these plans gonna stay into effect under Aetna so that next year during open enrollment, can I switch?
Yes.
Conversely, from advanced to value or value back to?
Absolutely. Now, what I look, yes, so you're gonna have, so next year, you will have the ability to review those two plans again and decide which one will be best. Now, of course, City of Titusville could decide to tweak benefits, so who knows if they'll be exactly the same or not, but every open enrollment, and they haven't told me they're changing anything. So when I say that, I just say that because in the event that they do. In the event they do, what will happen during open enrollment, we'll have the same kind of meeting next year. you'll get a choice to choose between the two plans, but that's an excellent question. So what you take today, you will be able to make a different choice if need be next year. Any other questions on the plan?
Yes, I have a question, I think it might be for Joe, just
Sure.
so that I'm kind of clearly understanding. So now we have two plans, we basically have a value plan and a buy-up plan. So which plan is being offered, or I guess both plans are being offered to actives? So are then if they choose the value plan, is that what the city is covering basically at 100%? And then they would have to pay the difference if we're talking about employee only?
Yeah.
And if I'm a retiree and have enjoyed 100%, for which I am very grateful, for a number of years now, are you gonna cover 100% me on the value plan? Are you gonna cover 100% for me on the enhanced plan, or what I think?
Right, right. Yeah, that's kind of what
I think that's-
Hillary
yeah,
was
I
at.
think that's
So
what it is.
so let's clarify. You got two tiers.
Understand.
Tiers, there's the retiree tier, just for purposes of our group here. So, assuming we're all retirees, right? All right, so you have different tiers, 5 tiers of a subsidy, meaning that the premium is reduced by that percentage. So if you're in tier 1, for example, and you have employee-only coverage, the city is continuing to pay 100% of that employee coverage. Now,
Of
in
the
the,
value plan or the enhanced?
either one. Either one. So if you choose the value plan, you have single coverage. Whether you're on the value or the enhanced plan, you're gonna enjoy that subsidy at 100%. Okay? So that continues. And then I wanted to clarify that with what Hillary was saying. So we're not separating, because you see different tiers there. Those tiers are associated with whether you choose your dependent, that you have a spouse, you have a child, and you have family, okay? Now, while you're seeing those, there is a difference if you're in, let's say, look at the subsidy, the retiree subsidy tier, where you're only getting 50%. So the numeric value is there to help you understand that if you're 50% in that tier 3, for example, you're gonna pay 50% of whatever enhanced or value plan that you choose. You still have that choice. Go to the active side. The active side, the active employees still have or enjoy 100% single coverage. City's gonna continue paying 100% of their, of the active coverage, and then 50% of dependent. That hasn't changed.
Wow, maybe if you make them pay 50% to you, we might reduce that liability coming.
Oh, yeah, that's another
Well,
discussion.
no, yeah.
But I hope, did I answer?
Yes, so tier 1, you fill out the form, you pick whatever plan you want. and
If
just-
you're in tier 1, you're employee only, it's kind of, yeah, I mean, your decision is you stay with the enhanced plan.
You're in the plan, you're using tier, meaning yourself, your spouse, employee, and when we go to tier, we're thinking of the subsidy. So
Correct.
I think it was just convoluted into whether.
Right, just try and separate the two, you're right.
Okay. Any other questions on your benefits? Okay. All right, Laura, I'm not sure if there's any other housekeeping items. I do know that they do need the forms returned. I think you can drop those off at the benefits department or HR department. So just know that you can get in touch with me if you need to. The HR team has my cell phone as well as my office phone. And Laura, I know there's a couple other things you may want to mention.
So we will have an open enrollment if anyone is sitting here for the, or if it applies, for the over 65 later on at the end of this month, next month. So you need to come back to that. Also, we had a question, what do we do with your email address? Your email address is for the purpose of communicate with you, not to sell it. We would never sell your email address. So comfort level there, it's for HR to use. We're updating our operating systems, and we're trying to get information so we can start communicating through email a little more, so you get some stuff quicker. Any questions? This is due by the 30th into HR. More than welcome to drop them off now, and we'll check them. If they're not completed, you'll be receiving a phone call perhaps to complete some information, so have patience if there's a couple phone calls made to you just to clarify. Because we want to make sure we're starting fresh, new, and so we want everything kind of just flow and have good information. Thank you for coming.
If you have any questions, I'm here. I know they have another meeting, so I'll certainly answer questions, and if need be, I'll meet you outside if they run us out.